I'm here to talk about the Joining Forces initiative because we have a problem. We need to ensure that we are all fully engaged to ensure that our service members, our veterans and their families get the care that they need and deserve.
Joining forces for me is near and dear to my heart as a person who spent their entire career within the VA system. And when these men and women return, I mean, they've made the ultimate sacrifice so we can enjoy the freedoms that we do today. They should be able to have good quality health care no matter where they live.
We have deployed about 2.4 million service members in support of overseas contingency operations in the last decade. And when you think about that, that's a very small percentage of the population, but they're spread out over a wide area of the country. Because what a lot of people don't realize is that we've heavily used the reserves and the Guard in this military operation. So 40% of that 2.4 million were either National Guardsmen or reservists. And where do they go when they're done? Do they go back to a military base or back into the military system? Not necessarily. Oftentimes they go home. And home can be a rural environment or someplace far away from the normal military environment where they need to be seen.
Joining forces is the right thing to do. It's the right thing to do for the healthcare system. It's the right thing to do for the service member. It's the right thing to do for the families. It's the right thing to do whether you're in academics, in research, or in clinical practice. There isn't really any room. It's a win-win across the board.
You know, people have this idea that it's Rambo and they're going to do bizarre things and go off into the woods and do crazy stuff. That's not what happens. People suffer silently, and that's kind of what we're doing with Joining Forces, is to get healthcare providers, and particularly the nurse practitioners here, to be aware, to understand, know what resources they need to get, but mostly in their practice ask about deployment history and combat exposure and that sort of thing, and then do what they need to do in order to get the individual the help that they need.
Supposedly it takes a village to raise a child. I would change that a little to tell you that it takes a village to bring people back into society who have been traumatized.
PTSD that has already been mentioned is sometimes recognized as the invisible or the silent wound of war. However, as you all have heard and will see, it's only invisible to those who aren't looking for it. For those who live it and those who experience it, family members, healthcare professionals, children, it's not invisible.
That it takes not just us as professionals, but it takes other caring individuals also to demonstrate to the veterans and their families that they are not forgotten, that they are a very special group of people who have offered up their lives and having their lives changed absolutely irrevocably in order to keep this country free.
It isn't just a military issue, it's everybody. This is our nation. When we talk about our service members, you know, they were glad to go, but I think we owe them the best that we can possibly give them. And if they go back home, and if they're back in their usual environment and they're suffering, particularly suffering from the invisible wounds of war, you know, particularly post-traumatic stress or concussions and the post-concussion syndrome, then we need to get them the help that they need, and nurse practitioners are going to be key in making that happen.